You have a patient recommended for back or neck surgery, a spinal fusion. Fusion or traditional back and neck surgery results in loss of natural movement, higher impairment, permanent work restrictions, and risk of cascading effects of additional treatments and surgery.
I did go see another doctor who recommended the spinal fusion.
I was referred to another surgeon who notified me I needed to have a total disc replacement as well as fusion, and then I would only be able to bend so far. So that wasn't an option for me.
It just seemed to be a better way, but I didn't know it yet. I just didn't want to go through the cutting of the bones and opening the back up and cutting through the muscles.
I didn't want any part of a fusion. If it had to be that way, then that would be fine, but it's just the hospital stay is so long, and then you've got like implants in your body and like your discs are fused, so that causes you right there to have, limited range of motion whenever you have the fusion like that.
A lot of mention of bone fusion, that the disc will be bad where you have to fuse them together, and that was a definite no.
We have a new and better alternative, a much lower cost outpatient surgery that enables most patients to return to work in just 1 to 3 days, the Deuk laser disc repair. Outpatient surgery means no hospital stay, which in turn results in lower cost and lower chance of additional complications such as infection. Fusion surgery can require up to 7 days hospitalization. With Deuk laser disc repair, our patients are usually on their way home within an hour of their procedure.
Yesterday this time, I was in surgery getting ready for a spine laser disc surgery with Dr. Deuk. I was still in pain. Today, I am great, terrific.
I would still be in the hospital if I would have traditional surgery.
The work comp doctor, from the injury at work, they sent me to a clinic, which they sent me to get an MRI. Basically, told me that I needed to see a specialist for my injuries, and it was a workman's comp accident. He said that it would basically take 45 minutes to proceed, to give you the procedure, and I'd be able to go back home. And it was incredible that the pain was gone from basically the procedure that was done 2 hours ago.
I went in at 7 o'clock and I was there for about 3 hours, and then I left and went home. So that was a great part. It wasn't having to deal with hospitals. I didn't have to stay overnight. I just went in, had it done, and I was able to come home the same day.
I didn't have to go to the hospital. I was in and out the same day. I went home.
The surgery was at around 8 o'clock, and I was heading home by 10.
Because this was an in-office procedure rather than at the hospital.
Well, when I went to my doctor, when I couldn't move my neck, he said, "You have a workers' comp claim." And he encouraged me to file with workers' comp. So I did, and they sent me to several doctors who sent me for MRIs and so forth, and then it was through them that I went to the other 2 neurosurgeons. But they had not had very much experience with Dr. Deuk because he was new to the area. So I would think for my workers' comp insurance company, I was probably the first patient that went through his office. And it was all very positive, and I think that they will continue to send patients through there.
Back to work in days instead of months means dramatic savings in lost wages. A traditional fusion recovery can take as long as 6 months before the patient is able to return to work. Many Deuk laser disc repair patients are back to work in just 1 to 3 days, dramatically reducing lost wages, physical therapy, and rehab costs.
I went back to work. I think it was the 3rd day when I just took those 3 days off and went right back to work.
Yesterday, which was the day of the surgery, I got to the office at about 11 o'clock. This morning I got up and came to work at 9 o'clock this morning. Did not have any medication or anything like that.
The next day I went to work, I was driving and I was walking.
I actually drove that same day. I had to go get pizza.
And I've been working, it's about lunchtime right now, and I'm good.
And I couldn't afford to take off work 6 to 8 weeks.
The next day I was back at work. No more headaches, no more tingling in my hands. Surgery did really, really well on me. Loved it. I'll do it again if I have to.
3 days later after the procedure on Sunday, it was a Sunday, I remember, I had to go to work. So I drove myself to work and drove every night after that.
I think that if it was a fusion surgery, I would have been off from work for 4 to 6 weeks. And with this surgery, the surgery was on Friday. I was back to work part-time from home on Wednesday and back in the office the following Tuesday full-time.
By definition, spinal fusion causes loss of natural motion. Hardware is attached to the spine to prevent movement between the vertebrae. This results in a higher impairment rating and permanent work restrictions. Deuk Laser Disc Repair does not use fusion or implants. It repairs damaged spinal discs, allowing the patient to retain natural movement with minimal restrictions.
And right after the procedure was over and I started to come out of the anesthesia, I noticed my range of motion increased. Now I'm back to 100% now.
My mom had the disc fusion, and I know they had to train her how to walk again, and I was up and walking, that same day.
I felt immediate relief of pain, immediate.
I was looking for someone that actually did the laser, where they wouldn't remove any structures, where they wouldn't add anything, so that it would maintain the integrity of my spine.
So I can still move my neck.
I have gone back to work. It did not interfere with work at all.
While there are other laser procedures available, only Deuk Laser Disc Repair requires no bone cutting. Other facilities use a procedure that removes bone from the spine to access the disc, destabilizing the spine and increasing the likelihood of additional or corrective surgery. Deuk Laser Disc Repair uses a proprietary method that does not remove bone or destabilize the spine. There is no internal scarring and impairment ratings remain low.
I'm so happy that I got the laser surgery.
I had the Deuk Laser Disc Repair.
I'm really grateful to Dr. Deuk. I just can't believe that this type of procedure is in our backyard right now. I can just drive, have the procedure done, and leave. It's amazing to have this here.
I was glad I did it. I should have did it 2 months before, but...
Deuk Laser Disc Repair as an alternative to spinal fusion surgery typically results in a cost savings of 50% or more. Add in lost wages of 3 days versus 6 months and a much lower impairment rating for the rest of your patient's work life. And you can see Deuk Laser Disc Repair is the only choice. Get your patient back to work in the fastest and most cost-effective manner possible. Deuk Laser Disc Repair. Call now to speak with one of our work comp coordinators and get your patient scheduled for an immediate consultation. Deuk Laser Disc Repair, the best alternative to spinal fusion.